Good day, it's Dr. Daniel Cameron. I'm here to discuss another All Things Lyme video blog regarding an article in the New England Journal of Medicine. The title of this blog is Netherlands Trial Does Not Support Short-Term Antibiotic Use. The investigators had presented data implying that 2 weeks of antibiotics was as good as 14 weeks of worth of antibiotic. And I can tell you, if you look again at the article in more detail, you'll find that neither group has done well. So let's look inside the article and discuss what we can find. Now, previously, longer-term therapy has been effective in some studies. Legidian was able to show in 1999 that 4 weeks of IV Recefin was more effective than 2 weeks in Lyme encephalopathy. Krupp showed that 4 weeks of IV Recefin was effective in post-Lyme disease, and Fallon in 2008 showed that 10 weeks of IV Recefin was effective for fatigue in Lyme encephalopathy with a trend toward less pain. There were 281 patients enrolled in the Netherlands trial. The average age was 43 to 48. 53 to 56% were men, 27% had an erythema migrans rash, 29% had a positive IgM Western blot, 64% had a positive IgG Western blot. The median duration of symptoms was 2.7 years. There were a median of 2 previous treatments, and the prior treatment median was over 30 days over the course of the 2 treatments. The symptoms were rather typical of Lyme disease: arthralgia, musculoskeletal pain, sensory disturbance, neuralgia, neurocognitive symptoms, and fatigue. Their quality of life was assessed on a short form 36 physical component of health called PCS. Examples of questions included: compared to 1 year ago, how would you rate your health in general now? Were you limited in the kind of work or other activities? And how much physical pain have you had during the past 4 weeks? All of these are very important questions for people who have Lyme disease. Their quality of life was worse than for diabetic and cancer patients based on a PCS score. The PCS score for the average population is 50. Diabetic and cancer patients have been described with scores of 42 and 41. Fallon's NIH-sponsored trial at Columbia was 37. Klempner's trials were 32. And the Netherlands Lyme disease trials were 31 and 32. The outcome on the short form 36 for all 3 treatment groups is described in this adapted chart from Burundi. The black rectangle was the group that started around 32, 33, and were prescribed 2 weeks of IV ceftriaxone followed by 12 weeks oral clarithromycin plus Plaquenil. The red triangle is 2 weeks of IV ceftriaxone followed by 12 weeks of placebo. And the blue oval is 2 weeks of IV ceftriaxone followed by 12 weeks of oral doxycycline. All 3 groups were well below the 50 for the general population. So if we look at that group over time and we look at their treatment, we can look at how the quality of life improved over time, up to 50 weeks. But if you look again at that curve, the treatment groups gained 3 points on a PCS score, but were 15 points below the general population. So if you look at this ruler, you'll see that even though the Netherlands Lyme disease patients gained 3 points on a PCS, there is still 15 points below the general population and well below the diabetic and cancer populations that have been described. So possible reasons that longer-term therapy failed for the Lyme disease patients in the Netherlands trial are: 1, retreatment delays showed a median of 2.7 years. They enrolled Lyme disease patients who had failed 2 previous treatments. Number 3, they had a poor quality of life on enrollment. And number 4, there was no evaluation for co-infections, including Babesia. The recommendations to consider for Lyme disease patients who have been ill for years, as described in this Netherlands paper, is they should consider longer initial therapy, For example, more than 2 weeks of IV in this trial. Earlier retreatment, don't wait 2.7 years. Evaluation for co-infections, and consider individualized therapy until the quality of life returns to normal. Thank you for joining us again today on another All Things Lyme video blog.